preferences that essentially wait for a very long time that don't necessarily need to be there. And that's based on NHS metrics. That comes from babies, so children 0 to 4 months, who essentially are there because they can't find support anywhere else, and A&E is the place that they turn to. We also know that lack of support in the postnatal period is linked to increased risk of stress, postnatal depression, not just in mums, but in dads and also in the other caregivers that surround that family. Again, we know that people who live in the most deprived areas are more likely to attend A&E and have a bad experience. And again, this all compounds because what it means is that if you are a person of colour navigating the system, you're more likely to have a poor experience. You're more likely to then not trust health services. You're then more likely to not engage in the future because you've had a bad experience. And that has then a big knock-on effect on preventative care and public health initiatives. So it's a really, really important problem, essentially. And it's a key health priority. Next slide, please, Gio. It's a key health priority within the NHS. So these are 3 really big, important campaigns called 20+5, the NHS 10-year plan, and Saving Babies' Lives, which all talk about ensuring continuity of care, personalised care for parents of colour, moving from analogue systems to digital, and encouraging healthy behaviours from a very, very early start. And essentially, this doesn't really currently exist in a cohesive way. And so I've built it in the app. Next slide, please. So the app, it's called the Awakened app, is essentially a really easy to use web-based app platform that provides postnatal education for parents of newborns. And in essence, what it's trying to teach you as a parent is what's normal, what's not, and when to seek help. And it goes through, again, sorry, there should be a video, but it's obviously not working. It goes through everything from your baby's first days to how to wean, how to feed, how to look after your baby's skin, how to brush your baby's hair, how to honour your cultural traditions and practices in a way that's safe and evidence-based. Again, from my personal experience thinking about being in ED, there are often times where I'll have a parent of a X culture come to me and say, oh, my mother-in-law's trying to do XYZ with the baby. I'm not sure if it's okay. I'm not sure if it's safe. Or, there's this ceremony that we do where we shave the baby's hair, and then the baby will come in with like a scalp infection just because people aren't aware of how to do that safely. So the app content essentially goes through simple and practical things like that. The articles are really short, so 2 minutes to read, and they're also supplemented with videos, which is essentially me explaining simple topics to you. It's parent friendly, and then the images and videos are really easy to use, and some of it is available in different languages as well. Next slide, please. I've done a brief test, a pilot test. This is the feedback that I've gotten so far, so it's all been really positive. The app is available for testing now, and essentially the stage that I'm at is thinking about trying to extend my research, trying to engage parents and patients, because my intention is very much for this to be co-produced. The MVP, which is what I've developed at the moment, really only covers the newborn period. But before I go any further, I'd really like input from parents and patients in terms of what they want, what they feel is missing, so that I can provide and develop a resource that's going to be really accessible and useful to the people that need it. Next slide, please. And so essentially, the potential benefits are huge. So from the existing research, not just on my solution, just the existing research that's out there in terms of culturally inclusive care, it shows benefits for both parents and patients, so parents/patients, and the health service. So for patients, it improves health literacy, it reduces stress and anxiety, and improves overall health outcomes for parents and children. And then for the health service, you get better use of health services, reduced attendances, the emergency attendances to GP and A&E, and ultimately a reduction in health inequalities, which is really, really important. Next slide, please. Again, this is just some of the feedback that I've gotten from the app, from the short pilot that I've done. But essentially, I'm inviting people to try the app out and give me some more feedback. And then last slide, this should be. So the next steps in terms of where I'm taking that, again, like I've mentioned, is really around user testing and evidence generation. Because this event's about inclusive research, I also just wanted to put in about research and regulation. So this is something that I'm obviously going to have to do as part of the app development, but just to encourage anyone who's watching that it's really, really important that people from diverse communities get involved in research, and my app is kind of a clear example of that, because there are so many resources out there that are designed for new parents, but they didn't necessarily have our communities in mind when they were being developed, potentially because we weren't part of the user group. And so just a plug out there to just get involved in research. And that's everything from me. So thank you very much.
Thank you. Yeah. So thank you so much, Aisha. And I did butcher the name. I apologize.
It's fine, don't worry.
Yeah. So just for those who came in late, would you be able to, I guess, give another introduction of the app just for a minute or two, just so that they get the whole concept of what it is? Because I know some may be coming in, and then after that, we'll switch over to the next person.
Yeah, that's fine. So again, my name's Aisha. I'm a pediatric doctor in the West Midlands, founder of Awakened, which delivers postnatal support to parents of colour. And the difference between my app and some of the solutions that are already out there is it's really about providing culturally inclusive and holistic care that sees you where you're at. There is more that connects us when we are raising our children beyond how we're racialized. So that is whether that's to do with our ethnicity, where we grew up, our religious backgrounds, and all of that melds together. And in the current system, there isn't really a solution that tackles that sees parents in that way. And so essentially that's what my app's trying to do. So it's culturally inclusive and holistic health education for new parents or parents with a newborn baby.
Amazing. Let's give her a virtual round of applause. Thank you so much, Dr. Aisha. So I'm going to put Dr. Aisha in the backstage, and I'm going to bring up our next person, which is Dina Paulomi. And we'll bring her on here. Brilliant. All right. Hi, everybody. Again, so this is our next clinician, and her name is Dina Paoloni. Did I say it right?
Yeah, thank you.
Brilliant. Yeah, so she is a clinical trials nurse. She has that background, so she's extremely experienced. And she is also the founder of Nurses Move. So I'll let Dina take it from there. And yeah, let's...
Thank you very much, Dr. Giovanni. I apologize for my voice, which comes and goes. I may need some extra sips of water along the way. Sorry about that, but I'm so excited to be here. Thank you very much for inviting me. So today I wanted to talk about the inclusion of internationally educated nurses in research, why it is important. Next slide, please, Giovanni. Thank you. So I wanted to start with a discomfort, especially for researcher clinician in this room. We always consider that design the most ethical study, the best protocol, and a clear patient information sheet is the important things to enroll patient in the study. But still watch people hesitant, disengage, or quietly say no. This is because something deeper is missing, the trust and representation of the workforce in research. We know that UK is multicultural, so if we want patients to feel safe, represented, confident to be part of clinical trials, representation can live only in the participant leaflet, but it has to live in the workflow as well. I am Dina Paoloni. I'm a clinical specialist in chronic pain, career coach for international nurses, CPD provider, independent researcher, and a former clinical trial nurse and international educated nurse coming in UK in 2015 from Italy. And this is what I want to make the case today for involving international educated nursing in research, because diverse nurses help diverse patients feel safe enough to participate. Next slide, please. Thank you. So here's the problem I want to name clearly. Representation research is often treated like a recruitment challenge. More posters, more campaigns, and more messaging. But in real life, representation is not a poster. Representation lives in relationship, in conversation. And relationships are built through the people the patients meet during their life experience inside the hospital or the healthcare facility. So it's the relationship, it's the trust, and speak to when they are scared every time there is a uncertainty or they feel overwhelmed. In UK, international educated nurses represent nearly 1/3 of the entire nursing register, as you can see from, these are from NMC latest report, 2025. And nursing is the big healthcare profession. We'll see, I've got another slide later. That means nurses are not a nice extra in research participation. They are one of the stronger levers we have to trust, communication, and engagement. Yet many international educated nurses are still under-supported to access the same research and innovation pathway that are more visible to nurses who are trained in UK or are native to UK. So we end up with a double loss here. We fail to provide to international educated nurses the path for their career, especially in research. And most importantly, we lose the important share of participation of minority. And so these reflect their life experience. Next slide, please. Apologize. So this matters because research is not only science, it's also human behavior. Patients enroll in study when they feel safe, when they understand what's being asked, and when they believe the system will treat them fairly. So nurses are often the one translating medical language into real life meaning. They're the one who notice hesitation, fear, confusion, and the unspoken question. And when nurses share cultural understanding, this is very important, or have the skill to communicate across culture, patients are more likely to feel respect, heard, and confident. That changes the quality of the consent conversation because patients are more involved and feel safe. It's changed whether someone say yes, whether they say stay engaged in the research, and whether they recommend participation to others. So involving international educated nurses in research is not only about fairness for the workforce itself, it's also about improving patient outcomes, because diverse nurses can help diverse community participate in study. And that produces evidence that it is more representative, more realistic, and more useful for improving healthcare delivery and outcomes. Especially considering that according to the Ipsos Veracity Index 2025, nurses rank number 1 for being trusted to tell the truth in UK. So nurses are the most trusted profession. Nurses make up half of the UK clinical workforce as per the NHS digital data. Next slide, please. Thank you. So as you can see, the total number of clinician staff in the NHS is around 750,000 more. And the total number of nurses, which we should add midwife as well, is 337,000 plus 26,000. So we really represent half of the clinician workforce. Next slide, thank you. This is why I created Nurses Move. Nurses Move is my career coaching and professional development firm built to help nurses, especially international educated nurses, but all nurses in general, to scale their career ethically, confidently, and strategically. And its core, Nurses Move, help nurses move from survival mode to strategy, not just coping inside the system, but learning how to position themselves, lead, and influence. We do that through 3 practical pillars. First of all, through career design and leadership identity, because many talented nurses are never taught how to translate their experiences into leadership language, research language, or innovation language. So we help them with career design to position themselves in the right place, the right moment for their skills. Second, cultural intelligence and professional voice. Because being brilliant clinically is not enough if you're constantly being misunderstood, overlooked, or forced to string yourself to fit in certain teams. And third, research and innovation readiness, helping nurses to build visibility, confidence, and clarity on pathways so they can contribute to research team, become credible voices in innovation and research, and help patients feel safer engaging with the research. This is not about giving nurses more work, it's about giving nurses more power so they can shape healthcare and not just delivery. Next slide, please. Thank you. Excuse me. So let me share some proof of the work that I've done in this year. Across my newsletter, we have around 9,000 subscribers with an open rate that is between 27 to 40%, which is a good number for newsletter open rate. And that tells you something important. Nurses are not just following, they are reading, engaging, and looking for guidance that feel relevant and honest. And from the data we got, we see that these newsletters are also shared via LinkedIn or via WhatsApp or the social media. So they find this content very interesting. I support 100 of nurses to improve their career, and my clients are highly successful because when nurses learn strategy, position, and leadership communication, their opportunity expand quickly. My free community is young. It started only a few months ago, but it already has more than 100 members. It's curated because I personally select participants, and that keep the space safe, focused, and genuinely supportive. And despite being free, is active because the need is real. Next slide, please. And finally, my work sit inside broader innovation conversation through my involvement in a project to retain international educated nurses in UK, in collaboration with the NHS Clinical Entrepreneur Program. So this is not a theoretical idea. This is a growing ecosystem built around one goal, empowering nurses to lead change, presenting patient trust through workforce representation. You can see from the data that I shared, the international educated nurses want to be involved in career progression and in research. They are seeking help because their system doesn't allow their natural progression. So this is why they're looking elsewhere to understand how to do it. Next slide, please. So my next step, my request for today for you is, if you are a nurse and you want to raise your profile and be more involved in research, join my free Nurses Small Career Coaching community. It's a curated, active space where we build confidence, visibility, and leadership skills so nurses can step into research conversation with credibility, and all nurses are welcomed, not only internationally educated nurses. And my second ask is for NIHR representatives, clinicians, and researchers. I would love to co-lead a patient survey on representation and trust in research, especially the role international educated nurses can play in making patients feel safe to participate. If you'd like to collaborate, please get in touch. My contact is info@nursesmove.blog. Thank you very much for your attention. Sorry for this voice.
Oh, thank you so much, Dina. And yeah, apologies for just not playing well, but you did amazing. Let's give her a virtual round of applause. So the last and final, but definitely not least, innovator is going to be coming up. So I'm going to be switching out Dina with her, and her name is Kate. I'm going to bring up your slide just so that we can make sure that we're on there. There you go. Yeah, so who we have is Kate Pingoy, and she is a hepatology nurse specialist and founder of LiverLearn app. So without further ado, I'm going to leave it up to Kate, and then after we're done with Kate, I'll bring all three innovators up on stage, and you guys can ask them questions about anything. We'll leave about a few minutes for that. But without further ado, here you go.
Right. Thank you, Gio. Hi, everyone. My name is Kate. I'm a hepatology nurse specialist and founder of LiverLearn. So I'm going to be presenting LiverLearn today. We have an MVP and currently looking for our pilot population. Next slide, please. So hepatocellular carcinoma, or HCC, is the fastest rising cause of cancer death in the UK. Most of the time, it's diagnosed late with little to no cure available. About 85% of primary liver cancer is HCC, and over the past decade, we've seen an increase of 50% of its incidence rate. Of those diagnosed, only 20% is at an early curable stage, so that's about 1 in 5. And 80 to 90% of HCC patients have underlying liver cirrhosis. According to cancer research, it is projected that by 2030, HCC will become the third leading cause of cancer death globally, surpassing colorectal, prostate, and breast cancer. With the increasing rise and rates of alcohol-related liver disease and non-alcoholic fatty liver disease, the UK is not on track to reverse the trend without doing changes to the surveillance infrastructure. Next slide, please. So now that we're aware that cirrhosis is the gateway, for every patient, unmonitored patient with cirrhosis is a missed opportunity for early detection. There's also a surveillance gap problem. NICE guidelines indicate that for at-risk patients, they would need 6 monthly ultrasound scans with or without alpha-fetoprotein. However, these targets were not consistently met. Early detection means early treatment. So patients on active surveillance are more likely to receive curative treatment and better chances of survival as opposed to those who are not monitored. Next page, please. When I started the nurse-led liver cancer surveillance in my trust, we were among one of the few trusts to have a centralized database spreadsheet of at-risk patients. What I was doing was manually putting in data by using our Trust EPR and other clinical apps. With this manual system, it can be likely that we will miss patients by months or years. Fast forward to present, due to initiative by NHS England and cancer alliances all over the UK, trusts are now starting to migrate their database or spreadsheets into their surveillance systems. However, these systems do not have real-time decompensation alerts. Knowing that a big chunk of the patients being monitored have cirrhosis, they likely are also at risk of developing decompensation over time. And lastly, next, please. Yeah. And lastly, with clinicians managing hundreds of patients, the data may be spread all over the place. Next slide, please. So according to statistics, about 4.5 billion is being spent by the NHS for cirrhosis, and 5 to 7% of compensated cirrhosis patients go into decompensation annually. With a real-time flagging system for early signs of liver decompensation, this can improve outcomes, which would include long-term patient survival, better prognosis, and decreasing costs to the NHS. This is where LiverLearn would come in. Next slide, please. With the gaps and pain points that we identified in practice, we are introducing LiverLearn, which is an intelligent dashboard with pertinent data needed in liver care. Next slide, please. LiverLearn is a one-stop shop. It will serve as repository for your liver patient data. It will serve as a monitoring tool for your requests and referrals. And of course, it will be an alert system, real-time alert system for flagging abnormalities and deterioration. Next slide, please. We aim to enhance practitioner experience by having all the information in one place. We also want to have a user-friendly interface with very minimal learning curve. We want to increase visibility of liver patient records, automate reminders of next due scans, appointments, and blood tests, and of course, flag markers, which may indicate liver cancer or liver decompensation. LiverLearn is LiverLearn is AI driven. So with more data being processed, that makes it more intuitive. Next, please. It is also designed for your full liver MDT ecosystem, meaning your liver CNS, hepatologists, gastroenterologists, and your NHS trust can find it beneficial. And of course, your cancer alliances across the UK, NHS England can also make this, use this tool in order to meet their targets and improve outcomes. On that note, I'll be showing you what LiverLearn looks like and how it works. Just as a caveat, the patient data for the purposes of this presentation are all synthetic, but they're based off clinical practice guidelines. So next slide, please. Once you're logged in, you can see the dashboard in which all the information that require your attention will be present. And if you go to the alert system, you can find patients that were flagged for abnormal results or deterioration. So if I click on Brian Smith, for example, who was flagged for raised AFP, you can go to the profile, which will show you patient demographics and the scoring system, such as your MELD and Child-Pugh. So these scoring systems will be calculated in-app once parameters are met. In the interactions part, you can also see the patient's clinical history. And if the clinician would want to access more specific results, they can go to the specific tabs. So if I click on bloods, for example, it will lead me to the blood tab. If you, next slide, please. Before that, sorry, prior slide, please. Right, that's okay. So for the next slide, yeah, next slide, please. Geo, next, please. Sorry. If we...
So sorry, I'm gonna put it back on. It's just freezing a little bit.
Oh, right.
On my end. So sorry, I'm not ignoring you. I'm just off the stage.
No, that's all right. Thank you.
Can we put in on? So I'm trying to put in Brian. It's just freezing a bit for that. Okay, I'm putting it in now. Apologies. Yeah, the slide's not going in. Can we move on to? So sorry.
That's fine. We can stay there. Yeah. So assuming that I went back to the dashboard and I want to see a patient who's decompensating, and I want to highlight the alerts and comments or recommendations part of the blood results. So for this patient with a MELD of 21 and Child-Pugh B9, this means that she is deteriorating. And the alert system is telling us that for her blood results, some of the levels are critical, and the user or clinician is being recommended to escalate this patient. In HCC surveillance, once a patient is deteriorating or decompensating, most of the time clinicians would decide to take them off active surveillance. So there is a status tab which would tell us what the status of the patient would be. If we can go to the next slide, please. Yes. So on the status tab, we can see that it's been set to pause. Once the clinician decides or the clinical team decides that she's back on the active surveillance pathway, they can set the status to active again, and it will be reflected on that tab. Assuming that this patient would require further intervention, it can be found on the others tab. So if we go to the next slide, we can see that this patient had paracentesis and a wellness check by the liver team. I will now show you the other functionalities of LiverLearn. So if we go to the next slide, please. So you have different navigation panes or pages on the panel, and you can add a new patient. Next page, please. You can access, before that as well, please. Yeah, you can access your patient list, so with corresponding status. So if they are on active surveillance, it will reflect on their pause, those diagnosed with HCC, disease, and discharge. You can also access overdue scans, next slide, or blood tests or appointments. And you can also have a look at the summary of your database, which is next slide. So for the summary, you will have the information or data which is in your database that will be especially useful for your audit and service improvement needs. And lastly, there is a knowledge hub where you can access your SOPs and templates and all the other relevant information that is needed in your department. And that would be all for me. Thank you.
Yeah, really, really good job, Kate. Apologies about the technical difficulties. The slides, sometimes they do freeze on this system, especially when you're streaming on multiple platforms. I'm gonna bring on the other innovators on here onto stage, and you guys will be able to, hold on just a second. Bring on everybody else. And if you guys have any questions for our innovators, you guys feel free to ask as we're all here. I'm going to be taking some questions. I know we're streaming on multiple platforms, so I'm going to be seeing what the questions are. And also we have to give and take. There is like a 10-second delay on some of them as well. So what I said 10 seconds ago, it won't register to them until then. So if anybody has any questions or any comments for the amazing job that they've done today, you can let us know. We'll be there for one more minute and then we'll start to go. Okay. Right. So it seems like we have some comments, but it's more regarding the platform, but not necessarily about the innovation. Okay. Well, thank you guys so much for your time. We're going to be going off live now, but if you guys do have any questions or anything you want to ask the innovators personally, you do have access to you guys should have access to their LinkedIn, which their LinkedIn will be on the Prober page or even on Eventbrite. You'll be able to find their full name and everything like that. Thank you guys so much. I'm going to end the live right now. Okay.